Hi everyone, this is Dr. Merhaut with Elite Sports and Spine Chiropractic. Continue with today's Elite Education series. We're going to do a spin-off of what we did last week. Last week we demonstrated lumbar spine adjusting for low back pain. This week we're going to be talking about thoracic spine adjusting, so from this area down to about this area, the mid-back, which oftentimes people complain about shoulder pain, which is the pain that's in between the shoulder blades. So we'll talk a little bit about the different styles of adjusting that we can do for that. We're going to be showing one where the patient is lying down. Today, again, we have Dr. Keklek as the patient. So we're going to be doing one face down. I'm going to be demonstrating one where the patient is face up, lying on the table, and then also I'm going to be showing one that we do seated. So there's multiple different styles of adjusting for this area for different reasons. Some of them have a little bit more force, some of them have a little bit less force. So depending on the patient and their comfort level, we basically pick which adjustment works best for that patient. So to start things off, we'll be doing the prone adjustment where the patient is lying flat on the table. Today, we didn't do any adjusting previous to, so I'm actually going to be doing the adjustment on him so you can get an idea of what it looks like and the amount of force that goes through it when the patient is lying down. So for Dr. Keklek, we're going to be adjusting through the mid-back right here, a little bit below from where the shoulder blades are. So I'm going to have him take a deep breath in, and I'm going to be applying pressure straight down into that area with both hands, and then a little bit of a thrust into that area, and then sometimes you hear that popping clicking sound. That's just gas being released from the joint because of the pressure buildup through those joints themselves. So that's an example of a prone adjustment with the patient face down. Next, I'm going to have him flip over onto his back, and we're going to be showing a supine adjustment similar to what I just did, but for this one actually we're going to be working on one side of the spine as opposed to with that one I was kind of adjusting through the middle of the spine. So for this one, I'll be coming over on the opposite side of the table. I'm going to take his hands. He's going to give himself a big bear hug right through here. I'm going to roll his body towards me so I can take my contact hand into the area that I want to adjust. I place it over the area I want to adjust. Same thing with having him prone. I'll have him take a deep breath in and then all the way out. As he takes that deep breath out, I'm just going to roll him onto my hand and then apply a little bit of pressure downward onto that area to do the adjustment itself. And that can be done on both sides. So I'll again show it on the opposite side for another angle where we bring him over towards this side. Apply contact to the area that needs to be adjusted. I apply pressure down as he takes that deep breath out. I roll him back onto my hand, and then a little bit of force can be applied through that area as well. Third adjustment that we'll show today is we're going to have the patient sit up. So he's going to face the camera this way. This one also looks like a bear hug. It's more of a global mobilization. So sometimes we're looking for a specific segment to get more mobilized. Sometimes we're looking for a global area to be more mobilized. So for this one, it's going to be more of a broad spectrum mobilization that you'll see when we do this one. So I'm going to have his hands straight over his face, kind of like he's covering his face. Arms are going to be in front. I'm going to give him a bear hug and apply contact and pressure over the area that I want mobilized with my chest for if it's one side or if it's through the middle. I'm going to be applying that pressure, and then as he takes the deep breath out, I'm just going to be giving them the bear hug and distracting upward through the spine. So those are three examples of mid-back thoracic spine adjusting that we'll do. All of them were comfortable for him, no pain involved at all with those. So some of them had a little bit more force, some of them were a little less force, but that's an example of thoracic spine or mid-back adjusting that we do in the office. There are other forms, but for our sake and purposes of today, just demonstrating a couple, those are three that we would typically do in the office. For next week, stay tuned because we are going to be doing cervical spine adjusting, so upper neck area. Oftentimes people are concerned about getting their neck adjusted for one reason or another, so we're going to talk a little bit about that, and then we're going to demonstrate different styles of adjusting the neck, so face down, face up, as well as some other low force mobilizations that we use within the office. So not all of them have that popping clicking sensation that some people are a little bit scared of. So this is the Elite Education Series. I'm Dr. Merhaut here with Dr. Keklek. Thanks for tuning in. I hope you tune in next week.